Okay, start. Go ahead.
Okay, I'm gonna do.
Probably went to the washroom too.
Gonna work down the stethoscope.
You want to get to the outside part?
Can I check your ID then?
Just pretend.
Okay, date of birth. Okay, my name is Julian. I'm gonna be your nursing student for today. I'm gonna be performing the head to toe assessment. Are you comfortable? Do you need to go to the washroom? I'm gonna close the curtains for purpose. Can you tell me your name? Where you are,
Pacifica,
and what day of the week is today?
29,
Okay, my patient is alert and oriented times 3. How old are you?
36,
Patient age is consistent with the ID band. Patient's skin color consistent with background. Body structure is symmetrical. Posture is erect and aligned. Position is sitting, and there's no visible physical deformities. Patient's facial expression is relaxed, maintains eye contact, speech is clear, and maintains eye contact. Uh, Patient facial expression is relaxed, maintains eye contact, speech is clear, and okay, I'm gonna go ahead and start selecting your face. Skin color is consistent with the patient's background. There's no visible lesions. Expression is calm and relaxed. There's no scars. Now I'm going to be testing cranial nerve 7, facial nerve. Can you smile? Show your teeth. Frown. Lift your eyebrows and flip your cheeks out. Okay, I'm going to have you close your eyes. I'm going to try to open. You keep as closed as you can. Okay, patient is able to do movement symmetrically and against resistance. Therefore, patient's cranial nerve 7 is intact. Now I'm gonna move on into the eyes. Patient's eyes and eyebrows, eyelashes, and eyelids are symmetrical by artery. There's even lash distribution and eyebrow distribution. There's no crusting, no discharge. The sclera looks shiny, visible blood vessels, and conjunctiva is pinkish, uniform color. Now I'm going to be performing cranial nerve 3, a test for the oculomotor. With Perla, I'm going to check your pupil size. Can you look at the wall for me? Okay, patient's pupil is around 5 millimeters. Eyes are round and symmetrical. Now I'm going to be testing your light reflex, okay, for consensual and direct. I'm going to have you look straight for me. Okay, direct reflex intact and now consensual. Consensual reflex is intact. Now I'm going to be testing her accommodation. I'm going to have you look at the tip of the pen and just keep looking. Okay, accommodation is intact. Now I'm going to move on into the ears. Patient ears, there's no visible discharge, no cerumen on both sides. Nose is midline and no discharge as well. Her lips, the colors are uniform, pinkish, there's no visible lesions. Now I'm going to be testing your cranial nerve 9, the glossopharyngeal, and the 10, the vagus. I'm going to have you open your mouth and say ah. One more time. Uvula is midline and soft platelet. Rise when patient says ah, therefore cranial nerve 9 and 10 is intact. Now I'm gonna be checking your cranial nerve 12, the hypoglossal nerve. I'm gonna have you open your mouth and then move your tongue side to side. Okay, now I'm gonna have you say light, tight, and dynamite.
High, dynamite.
Patient's tongue is midline, able to do movement in a smooth way, no tremors, therefore cranial nerve 12 is intact. Now I'm gonna move on into your neck. I'm gonna be inspecting, palpating. Do you feel anything?
No.
Okay, there's no tenderness. Temperature is warm to touch. There's no enlargement of the thyroid, no lesions, no scars. It's symmetrical and the head position is aligned and erect. Now I'm gonna move on into your test cranial nerve 11, your spine accessory. I'm gonna have you rotate your head side to side and then shrug your shoulders. I'm gonna apply resistance. You try to move, okay? This first. Okay, other. And now your shoulders. Okay, patient's able to complete movements in a smooth way and against resistance. Now I'm gonna move on into your posterior thorax. Turn your side, please. I'm gonna be inspecting. Patient, there's no lesions, no scars. Patient's thorax is symmetrical. There's no visible deformities. Now for palpating. Does it hurt when I palpate? Okay, patient reports no pain, there's no tenderness. The temperature is slightly warm to touch. There's no pulsations. The thorax extension, can you take a deep breath for me? Okay, is symmetrical and there's no deformities. Now I'm going to be auscultating it. Deep breath. Bronchovesicular sounds between the scapula are clear. And vesicular sounds in this peripheral are clear. No crackles, no whistles heard. Now I'm gonna move on into the apical heart rate. Sit down, please. Apical heart rate is in the mitral valve, mid-clavicular on the left side. I'm gonna have you lift your breath for me, please. Gonna come for 30 seconds.
Okay, there's no masses, no tenderness. And can you please breathe for me? Okay, so it's symmetrical expansion of the thing. And now I'm gonna ask for
There's 43 beats times 2, that's 86 beats per minute per heart rate. Now I'm gonna be checking for the rhythm is regular and the strength is a 3 plus strong. I'm just gonna check for any murmurs or bruits in S3 and S4. No extra sounds, bruits or murmurs heard. Now I'm gonna have you lie down in supine position for me. And then I'm gonna go over you. I'm gonna have you lift your shirt a bit. Okay, I'm gonna be inspecting her abdomen. Skin color is consistent background. There's no visible discoloration. Abdomen looks symmetrical. There's no pulsations. gonna check her umbilicus, if it's midline.
5 minutes, Juliana, okay?
Umbilicus is midline. And I'm gonna be auscultating all 4 quadrants, starting on the right lower.
So that's the
Right upper,
7 and there's no
left upper,
sound, so I can hear on this.
and left lower.
I'm gonna check for your abdomen.
Her vowel sounds are hypoactive, most heard on the left lower quadrant. Vowel sounds are low pitched gurgling, and the rate I would say it's 530 sounds per minute. And I'm gonna be lightly palpating all 4 quadrants. Just her, left upper. There's no pulsations. The abdomen is not. There's no rigidity, and it's warm to touch. Done. Sit down.
Finish. I'm gonna stop this thing.